I wanted to talk about something that has been on my mind for a while, and we've only been able to talk about it a little bit over the years because it seems that there's always something going on in the news. But a new study recently came out that showed that the United States is the last among 11 wealthy countries for healthcare. The last, dead last. The US is the worst performing nation for healthcare among a group of 11 high income countries, according to a new study by the health policy think tank, the Commonwealth Fund. The top performing countries in the study are overwhelmingly European: Norway, the Netherlands, Australia, the UK, Germany all took the top 5 spots. New Zealand, Sweden, France, Switzerland, and Canada completed the top 10, with the US coming in at number 11. Researchers evaluated countries' healthcare performances based on 5 metrics: access to care, care process, administrative efficiency, equity, and healthcare outcomes. The US ranked last among all of these metrics, except for one: care process, where it ranked second. The study found that the overall healthcare performance in the US is so lacking in comparison to other peer nations that we have calculated that the average performance based on the other 10 countries, excluding the US, is what the one of the people running the study said. And despite these poor incomes, researchers estimated that the US spent almost 17% of its gross domestic product on healthcare in 2019. Healthcare is 17% of our economy, folks. Significantly more than Germany, which spent the next greatest percentage of its GDP that year at 11.7%. Now, before I get out of here, because it's 7:48, I want you to think about this. I'm gonna give you some things to think about. According to the U.S. Census Bureau, there are 26 million people in the United States who had no health insurance coverage in 2019. Now, this is lower than the 45 million people who were uninsured before the Affordable Care Act was implemented, but still 26 million people. And this is in 2019. Before coronavirus caused a lot of people to lose their jobs and their homes and everything else. When you add federal taxes, state taxes, local taxes, sales taxes, and other services, and include other services that our taxes don't cover, but other countries' taxes do, like insurance premiums, Americans actually give away more of their wages than the rest of the world does. And so a lot of people say, well, the reason that America's healthcare system costs more is because, well, we have so many hospitals and so many beds, and in those other countries they have to ration care. Well, guess what? America has fewer hospital beds per capita than Turkey or Brunei. America has a lower life expectancy than Cuba or Lebanon. In places like Appalachia and the Mississippi Delta, we have a lower life expectancy than Bangladesh. Think about that. Appalachia and the Mississippi Delta have lower life expectancy than Bangladesh. We have a higher infant mortality rate than Russia or Serbia. And yet we spend 17% of our economy on healthcare in comparison to 11% from the second highest country. So why is healthcare so expensive in America? Well, because people have to look for in-network physicians. They have to schedule established care appointments and ask your insurance company to cover it. In Britain and every other first world countries, public hospitals provide free treatment to those who need it. They get it from the taxes and then they just give it to the public. You don't have to call some insurance company and hope and pray they'll cover it for you. But yet per capita healthcare spending in the United States is 3 times what it is in Britain and 5 times what it is in Canada. Drug companies are allowed to charge whatever the hell they want in this country because they are essentially allowed to negotiate in whatever way they want. In other countries, they negotiate collectively because the taxes are paid collectively and the healthcare system covers everyone collectively. And so because of that, in Canada, a carton of insulin is $20. Guess what it is in the United States of America? The richest country in the history of the world. $300. Private insurance companies ensure that hospitals will go out of their way to gouge all of us. For instance, in 2015, the average MRI scan was $215 in Australia. In Spain, it was $181. You want to guess what it was in the United States of America? $1,120. 1/3 of all the costs of healthcare in this country are spent on administration, which is more than what we spend on preventative or long-term healthcare for our citizens here in the United States of America. In England, giving birth is free. You go to the hospital when it's time, you give birth, you walk out with your child. It costs tens of thousands of dollars in America. In the United States of America, you are forced to pay a skin-to-skin contact cost when you give birth. That means you are essentially paying to hold your own child. If you're a woman who just gave birth to your child, you are forced to pay to hold your own child. 1 in 3 GoFundMe campaigns in the United States of America are now for medical treatment. 1 in 3. Americans are drowning in medical debt. Americans are drowning in medical debt. From 2009 to 2020, medical bills were the largest source of debt in the United States, with a record $140 billion owed last year, according to a recent study from the Journal of the American Medical Health Association. The record accounts only for the debt that has been sent to collections. And so once again, one of the big narratives that the right wing and even some corporate liberals love to tell us is that, once again, the reason that we pay so much is so that we won't have to wait for medical care. We won't have to wait for medical care, folks. Well, listen to this story. A man was shot 6 times and had to wait for more than a week for surgery after the hospital is overwhelmed by COVID-19. He had to wait over a week. Jose Valdez was in a hospital bed at Bentab Hospital in Houston, Texas, awaiting surgery after he was shot 6 times outside of a grocery store as an unlucky bystander in a domestic dispute. He tallied his injuries, which included a neck wound and 3 gunshot wounds to his left shoulder that's in need of surgery. This man waited over a week to get surgery. In the United States of America, the richest country in the history of the world, Americans pay far more for health insurance than any other country in the world. And yet we are at the bottom of our peer nations in terms of medical care, preventative care, long-term care, infant mortality, and life expectancy. It's time, folks. It's time. Talk to your congressmen and women, your senators, about Medicare for all, universal health care like every other country in the world has. At least every rich country in the world has. It is time to make health care available for all Americans. Good health care. Not the substandard crap that we get now because we have cartels in the drug companies and the health insurance companies running it.